In Jamaica, for example, you have to be in good community standing, and you're not allowed to have long hair. If you want to, well, women can have long hair, but men cannot, which I think is a clear discrimination against Rastafarians. Canadian, and the last thing I just want to highlight is that Canadian employers have the right to, and this is the language they use, order workers by gender, by ethnicity. So you can, say I want 10 Jamaican men and 7 Mexican women, and you order these people and they are sent to you. There's a practice of naming workers for to return the following season, so that if you're deemed to be, a good, quiet worker, then you are named. You can be named to come back again. So I want to move into talking a little bit more specifically about. I think there are. A lot of these issues obviously exist for both men and women who come on this program, but I think there are some concerns that are very specific to women. Both in terms of mental health, which I've done a lot of work on mental health, but also especially, and I'm sure you can imagine some of the reasons why, sexual health and reproductive health. And today I want to focus in on sexual health in particular, because I love to talk about sex. So basically I'm going to talk about a few things. I want to talk a bit about and kind of just list some of the barriers that women face in accessing sexual and reproductive health services and resources, barriers to leading safe and satisfying sexual lives and reproductive lives, and then some of the concerns that our group has come across again and again with women who are working in Ontario on farms. So one of the things I should mention before going on is that the men and women who participate on the SOP do qualify for provincial health insurance. So in Ontario, they have OHIP, and they should have an OHIP card, though this doesn't always work out. So in terms of accessing sexual and reproductive health services, I think there are lots of concerns in rural areas for anyone trying to access good, reliable sexual health services. Like sexual health clinics have very limited hours, they're very spread out. So any women who have a job or unreliable transportation have difficulty accessing these, but migrant workers in particular who are working extremely long hours, who are working usually 6 to 7 days a week, who are fearful of asking for time off, who are especially fearful for asking for time off if it implies some kind of illness. It's extremely difficult, virtually impossible for these women to access these kinds of services. Their mobility is extremely limited, again, partly because they're in rural areas, so there's not public transportation, but also often they're relying on bicycles to get around very long distances. Often it's nighttime, it's dark already when they finish work, and in many situations people are completely reliant on their employer, so their boss, to drive them if they need to go to the doctor, which obviously there are some concerns there with confidentiality and trust and so on. Many people that we've talked to don't always have access to their health card, so this is not a legal practice. The health cards should be distributed to the people themselves, but in a lot of cases employers are holding on to these cards for safekeeping, and I don't know if maybe some people really genuinely believe this is helpful. I'm skeptical. But effectively what it means is that, men and women have to go to their employer to ask for their health card and often have to explain, well, what is it that you need, what is your problem? And I think for women who usually have male employers, and there's already so many issues of power and inequality and trust and so on, having to explain, especially a sexual health-related concern, is extremely, can be extremely humiliating, scary, and so on. Another interesting thing is the men and women who come on this program are covered by, and I think it's a Royal Bank insurance policy, to cover things that aren't covered by OHIP, to cover prescription drugs. But this policy does not cover contraceptive methods. So I called RBC to ask them about this policy, and I was told that, oh no, we don't cover things like birth control pills because we can't cover anything that's for a pre-existing condition, which is a very interesting way of thinking about women's ability to become pregnant. Is a pre-existing condition, so we can't, cover anything to prevent pregnancy. So that's crazy, I think. Obviously, a huge barrier would be lack of interpretation services, especially in rural areas. 55% of the men and women coming to Ontario speak Spanish, little to no English, and there is literally almost no one who can translate in medical facilities. And I've seen some very extreme cases of this where people are being operated on and not, knowing what is wrong with them exactly, or certainly not being able to consent. They don't have, the doctors and nurses don't have basic information. I've had a couple of situations where I've been interpreting for someone at a doctor's office, and the doctor just says, oh, I don't have time for you to be, translating, just answer the questions. And so wanting me to answer the questions without asking the woman herself what, and just assuming that I would know and I should tell him and we just need to, get on with this. So that kind of, I think there's lots of issues with going to the doctor and not having enough time, but I think there's quite a bit of racism involved in these situations as well. Lots of breaches of confidentiality in medical situations, especially if there's no interpretation services. Employers are often seen to be kind of a benevolent presence if they take someone to the hospital or to a clinic. Lots of medical information is divulged. This summer I went with lots of women to medical clinics and hospitals, and in each place they were always asked, what farm do you work on? And so having to give that kind of information is extremely threatening because the fear of repatriation for being sick or for being pregnant, which is also a common occurrence, is very prevalent. Also situations where medical professionals call the employer to give test results or to say we need to come back for a follow-up instead of contacting the woman herself, which is very problematic. So some of the barriers, I'll just list these quickly, just kind of pursuing a safe and satisfying sexual life, include a very severe lack of privacy. Obviously, women are living, and then men as well, are living in very close quarters, sharing rooms with at least one, often multiple other people. Employers have the right to impose essentially arbitrary farm rules, so things like curfews, rules about having no visitors or no visitors after a certain time. There are a number of houses that have signs posted in English and in Spanish saying that a security company has been hired to monitor the comings and goings from this house, and any breaches of the rules of no visitors after 8 will be reported and dealt with accordingly. There are explicit attempts by employers to discourage sexual relationships among men and women. And I also want to say that these kinds of rules and these attempts tend to, in my experience, tend to be a lot stricter or more strictly applied to women than they are to men. And I think there are lots of kinds of assumptions about and traditional views of how women should, behave and what they should be engaging in. Well, naturally, men are going to be, you can't help it. I think another issue, of course, is sexual violence and harassment. A lot of women talk about harassment by coworkers, employers, and also during the medical examination that they have to undergo before coming to Canada. I've had numerous women talk to me about uncomfortable situations with doctors, but of course feel like they certainly can't report it or say anything. And then there are also effects of agricultural labor and pesticides on infant and maternal health. And then the last thing I just want to talk about a little bit is one of the main concerns that we've seen with women who are working in this community, having to do with unwanted pregnancies or unintended pregnancies and how to deal with these situations. There's a very serious fear of repatriation if you're pregnant. Obviously, you can't come on the program in the first place if you're pregnant, and most people know someone who has been repatriated when they were found to be pregnant. And I don't know how often that actually happens, but it certainly has happened. And of course, even if it wasn't happening, the fear of that happening is quite legitimate and really pressing.